Assistant Professor, SNS College of Pharmacy and Health Science, Coimbatore, and today we are going to discuss the topic about adverse drug reaction, which is simply known as ADR. So first we can go with definition and I explain step by step. Okay, first adverse drug reaction definition. So adverse drug reaction is the harmful reaction. So adverse drug reaction is nothing but it is a harmful reaction to the medicine given at a correct dose. So it is not a toxic reaction. If we given in a correct dose of the drug also, it can be caused the ADR. So some type of reactions are caused due to the overdose of the drug. That's our toxic reaction. But this is the if you give the correct dose of the drug also, which can leads to the ADR. So the reaction can start from as soon as when we take the medication or up to the 2 weeks after you stop. So the reaction can be start within few seconds to minutes or up to 2 weeks after stop the medication. And adverse drug reaction can cause the serious conditions. The adverse drug reaction can cause the serious condition such as toxic epidermal necrolysis. So toxic epidermal necrolysis. Epidermis means skin. So related to the skin damage. And anaphylactic reaction. So anaphylactic shock reactions. So which is the toxic epidermal necrolysis is also known as TEN. So TEN is the severe skin damage. I already told epidermal necrolysis. So epidermal means skin. And anaphylactic is a sudden and life-threatening condition. So anaphylactic means sudden and life-threatening condition need the immediate medical treatment. So here is the adverse drug reaction, which is a visual representation. It is a toxic epidermal necrosis. So the anaphylactic reaction can cause the swallowing in the face, lips, tongue or throat. It can be caused by swallowing in the face region or nose or the tongue or the throat, so or lips. So the type of region was swollen, and trouble in breathing or wheezing. So if unable to breathe, which can cause the wheezing problem, and drop in blood pressure, which cause the blood pressure is drop, which can cause the dizziness and fainting, can lead to the shock or death immediately. So if you cause the anaphylactic reaction, you can see the doctor immediately. So don't delay, which can lead to the death. So next on the mild symptoms of anaphylactic reaction. So anaphylactic reaction, the mild symptoms can be red and itchy skin. So red and itchy skin, here is the image which is the red and itchy skin. So the skin area should be red color and which produce itchy. And flaky skin, which is the skin of the snake. And swollen skin, the body part leg and hand or get swollen and face or get swollen. And flat and red area covered with the small pulse. So small the skin area is covered with a small dot like pimple like structure, but it is not a pimple. It is look like a hives. Hives means small bump like region. So severe symptoms. So severe symptoms which can be peel or blister the skin. Which in severe symptoms, the skin from the body is blister or the peel. It is completely peeled from the body. And vision problem, which can cause the which can cause blurry vision or the vision loss. And severe swelling and itching. The body completely became red and itching and swelling, and which can be treated immediately unless it can leads to death. So anaphylactic symptoms. So what are the symptoms of anaphylactic reactions? Is the throat tightness. The throat muscles get tightened. So it is unable to breathe in and breathe out, and trouble breathing and tingling sensation in the hand and leg. And dizziness. So it is a vertigo, dizziness. This is a major symptoms, and a wheezing problem. So these are the symptoms of anaphylactic reaction. So anaphylactic reaction is not caused by any medication, not only caused by any medication, but it is also caused by the some of the exercise, that is known as exercise induced anaphylactic reaction. If you some type of antibiotic can be also which induce the anaphylactic reaction. So how anaphylactic reaction can be diagnosed? So if someone have anaphylactic reaction, we want to know their medical history and their allergies problem, and can be tested using various tests. If the person have exposed to the exercise which can cause anaphylactic reaction, which is known as exercise induced anaphylactic reaction. So medicine can be triggered. If the medicine can trigger the anaphylactic reaction, we want to find out which medicine can trigger the anaphylactic reaction. So there are the several types to test the medicine induced anaphylactic reaction, which are given in the following slides. Okay, next, this is a patch test. So nothing, the patch test means the small amount of drug put on your skin, a small amount of drug which can be put on the any place of the skin region, and which can be covered with the patches, and wait for 2 to 3 days. After 2 to 3 days, the doctors can be checked whether the particular patch area has any inflammation or itching. So if the person have any inflammation or itching, the particular drug have an anaphylactic reaction, the particular drug have the adverse effect to the patient. So next one is the skin bricks test. So skin bricks test also similar. In this test, a small amount of the suspicious, or we have the suspicious drug can be dropped into the river forearm and brisk using the small needles, also wait for the 1 to 2 days whether the brisked area has swallowing or itching. It is similar to the skin patch test, but it has a skin brisk test immediate result when compared to the skin patch test. Okay, next, intradermal test. So dermal means you already know it is a skin, so it is nothing. The drug can be injected through the intradermal route. The drug can be injected through the intradermal route, and the drug can be under the skin. Under the skin area, the drug can be injected, and the doctors can be observed for 2 to 3 days any allergic reaction or any allergic itching or produced in the particular area. And drug provocation test, also known as challenging test. So it is important. Some questions are asked, what is challenge test? So challenge test is also known as drug provocation test. Drug provocation test is also known as challenge test. So if you have the allergy to the paracetamol 750 mg, they started to test from the low dose in which amount of drug have produced the allergic reaction. So they start from the low dose. For example, 250 mg, paracetamol 250 mg, they started to test until the higher dose 750 mg. They check the each dose, which dose can cause the anaphylactic reaction. So the reaction may be rashes, trouble breathing, nausea or other symptoms. The doctors may be monitored and they fix your therapeutic dose. In rare case, if there is no alternative medicines are available, or the alternative medicines have severe or harmful effect. And how the adverse drug reaction can be treated? So adverse drug reaction can be treated with the antihistamine, which reduce the histamine level of our blood. The histamine which is responsible for itching and rashes, and epinephrine, which is an important for immediate reaction. If the anaphylactic reaction occur within few seconds, we can treat it with the epinephrine. And steroids is used to reduce the inflammation like arthritis. So that type of cases we can use the steroids, like swelling in the bones or joints. So that type of case we can treat it with the steroids. And desensitization, if we take the paracetamol is only our last option for a drug, there is no other alternative option of drugs, then we can do the desensitization. Desensitization is nothing, we can start from the small dose like clonazepam of 0.25 mg to 2 mg. They increase the dose a little bit, 0.25 mg, 0.05 mg, 0.075 mg, 1 mg, 1.25 mg. So they are slowly increase the dose. Then the body get accepted, our body get accepted to the certain drug. So these are the treatment for the adverse drug reaction. So these are the topic we covered in the adverse drug reaction, like how can be treated, what are the symptoms and definition. So these are the topic we covered in today's topic. And thank you for watching video. Have a great day.